Thank you, Nation Talk, for hosting this broadcast in the Nation Talk studio this afternoon. Much appreciated. To our listeners and viewers, thanks for welcoming us into the airwaves, into your homes, wherever you are watching or listening from across all the nations of Turtle Island. It's an honor and privilege to be having such an esteemed group of strong, resilient, Indigenous powerhouse women today. We have with us Dr. Nell Wyman from Indigenous Physicians Association of Canada. We have Leah Bill, who is the president of the Canadian Indigenous Nurses Association. And last but certainly not least is Chair Bonnie Healy of the First Nations Information Governance Center. This is another edition brought to you by the First Nations Health Managers Association, where we're going to talk about COVID-19 and some topics from a health professionals' lens and data as well. I have to say a couple of thank yous to Indigenous Health .ca. So that's indigenoushealthtoday.ca. Thanks for having us and hosting us. And I know you're full of resources for anyone looking for valuable, any kind of information with respect to COVID. We thank you for hosting those resources. And for our listeners and viewers, if you're near a computer and you have a question, this is your time to get your questions answered by any one of these panelists. If it's not applicable for this town hall, we'll make sure we ask future panelists in those questions. So if you want to email us, please do so at fnhma@ihtoday.ca. Again, that email for your questions is fnhma@ihtoday.ca. We'll have a whole host of thank yous, but for now, I want to start off with a little funny. If we can't laugh at ourselves just before we get into the heavy dialogue, then who can we laugh at? Because my family and my cousins sure had a good laugh at me last week. They were telling me I look like a drag queen. I was so heavy-handed with my blush. So I told my glam squad this week of me, myself, and I, lay off the blush a little bit. So stop sending the hateful emails. I got it, but sure a chuckle with me. That laughter of Indian women across Canada just lighten up and putting a smile on our faces during such a troubling time. And we know laughter is medicine. Now, speaking of medicine, let's get started. We have with us Dr. Nell Wyman, who represents as the president of the Indigenous Physicians Association of Canada. Nell, welcome to the FNHMA Town Hall.
Bonjour, Annie. Thanks, Marion, for having me, and to the First Nations Health Managers Association. I'm really happy to be here, and along with my colleagues, Leah and Bonnie. So another thing your listeners might want to know about me is I'm originally from Little Grand Rapids First Nation in Manitoba. I'm a 60 scoop survivor, and I currently work as the acting Deputy Chief Medical Officer in the Office of the Chief Medical Officer at First Nations Health Authority in Vancouver. I'm a psychiatrist by training, and I've practiced for about 20 years in rural and urban settings with Indigenous First Nations people, and I've also done some remote outreach work. So I've now moved into population and public health, and the response to COVID-19, of course, has been very intense. I just want to make a land acknowledgement before I start. I'm an Anishinaabe, not on my ancestral territory, and I respectfully acknowledge the land on which I live, work, and play is the traditional, ancestral, and unceded territory of the Coast Salish peoples, the Musqueam, Squamish, and Tsleil-Waututh nations. The IPAC vision, which is the Indigenous Physicians Association of Canada, is for healthy and vibrant Indigenous nations, communities, families, and individuals. supported by Indigenous physicians and others who are contributing to the physical, mental, emotional, and spiritual well-being of our people, and having a positive impact on the social determinants of Indigenous health. As the IPAC mission, as Indigenous physicians and students who are diversely rooted in our traditional teachings in our respective communities, IPAC members embrace and commit to collaboratively use our skills, abilities, and experiences to advance the health of our nation, communities, families, and individuals. IPAC is an organization that shares knowledge, advocates for Indigenous people's health, and supports Indigenous physicians, residents, and medical students. With the onset of the COVID-19 pandemic, we are all living in challenging times. I want to acknowledge the IPAC membership, my Indigenous physician colleagues who are working on the front lines, and those working in specialties such as public health and forensic pathology. The Indigenous residents and medical students who have had their training delayed, interrupted, or otherwise disrupted by the pandemic. I want to give special acknowledgement to the medical school classes of 2020, our Indigenous medical students who have had their training delayed, who are graduating as physicians, but who have had their graduation ceremonies delayed by the COVID-19 pandemic. There will be a time when we can come together and celebrate all of you, surround you with love, hugs, and congratulations. But mostly, I want to thank all of the people who are working on the front lines in all health professions, social professions, in all of our First Nations communities across the whole country, rural, remote, and urban settings. Miigwech for your dedication and service, and a special shout out to all of the nurses who work in our communities. And next week is National Nurses Week. Some of the messages that IPAC would like to convey: there has been a great deal of variability between communities, regions, and provinces in the incidence and prevalence of COVID-19. Some First Nations communities in British Columbia and in northern Saskatchewan, for example, have experienced outbreaks, while some First Nations communities have only had 1 or 2 cases or very few cases, and some communities had none at all. So for now, we do need to continue to maintain physical distancing. This doesn't mean that we need to be apart or disconnected. We are encouraging the concept of distance socializing, meaning maintaining that distance of 6 feet or 2 meters, but staying emotionally and spiritually connected to one another. We are also encouraging people to continue with meticulous hand hygiene, washing your hands frequently, trying not to touch your face. I'm really bad at that one, and I need to be very mindful of that in this day and age. Using hand sanitizer if water and soap is not available. And as I mentioned, we need to try to think of ways to stay connected with our families, with our friends, the people we care about, our communities, and our cultures. So staying at home does not necessarily mean that we need to stay inside 24/7. Home in this sense can mean our traditional territories. So getting out on the land, being active, and participating in cultural or spiritual practices, as long as we are maintaining that physical distancing and hand hygiene. While there have been some instances where the response to COVID-19 in communities is going well, this is not always the case. You may have seen some media coverage that some of our IPAC members have been meeting with the Minister of Crown Indigenous Relations, Carolyn Bennett, to discuss some of the challenges that they are facing across the country during this pandemic. Some communities are still having challenges acquiring adequate supplies to address the risk of COVID-19, and this would include personal protective equipment such as masks and gowns, and other basic necessities such as hand sanitizer. Indigenous and First Nations people have and continue to experience racism in the healthcare system, and we as Indigenous physicians, in partnership with other Indigenous health professionals and organizations, must continue to work to achieving cultural safety for our family members within the healthcare system. Because also First Nations people continue to experience disparities in the social determinants of health, There are significant gaps in our health and mental health status. Higher rates of chronic diseases such as diabetes, heart disease, lung disease such as COPD, and some mental health conditions, including complex chronic post-traumatic stress disorder. Again, these pre-existing physical conditions put us at increased risk of poor outcomes or more severe symptoms should we contract COVID-19, and our experiences of complex trauma, including historical, intergenerational, and contemporary trauma, challenge our levels of emotional distress and ability to cope during this pandemic, which will continue for some time to come. This emotional distress is related to things such as potential increased substance use, including alcohol and rates of domestic violence. We believe that credit for keeping the virus out of our communities for the most part should go to the communities themselves. Self-determining measures that have been taken are reducing the virus transmission. The vast majority of community members recognize the risk to their communities, especially to our elders who may be at increased risk of a severe course of COVID-19 due to their age and pre-existing medical conditions. They are our knowledge, language, and culture keepers, and we must continue to adhere to the recommended public health measures in order to keep these precious people safe. As our various provinces and territories start the initial phases of opening up again, we need to remember that in our rural and remote communities, our curves are somewhat lagging behind the provincial and territorial curves, meaning we must remain vigilant and adhere to the recommended public health measures in order to continue to stop the transmission of this virus. Communities will also have to consider how they want to manage potential movement of people into or near their territories once various provinces and territories proceed with their phases of reopening. Communities are to be congratulated for doing the best they can under all circumstances and to remain ready for any upsurge in cases or a possible second wave of COVID-19. Lastly, IPAC has been working with our international Indigenous partners of the Pacific region, Indigenous physician organizations in mainland US, Hawaii, Australia, New Zealand, and Taiwan. We are sharing resources, ideas, and messaging to encourage the Indigenous First Nations peoples in our home countries to hold the line and stay safe. We want to especially acknowledge our colleagues of the Navajo Nation in the US that has been so hard hit by COVID-19. IPAC has participated in some efforts to be helpful, and we will continue to do so for as long as this pandemic lasts. From a mental health and wellness perspective, I want to remind everyone that we aren't just working on COVID-19 or on the response. We, each and every one of us, are living through it. So we need to be patient with ourselves. This is a marathon, not a sprint. The mental health and wellness consequences have been recognized during this pandemic, and there are many resources available, some of which we can potentially talk about in the Q&A section of this town hall. But it is important to remember that taking a holistic approach, caring for our mental, physical, emotional, and spiritual aspects will positively impact our overall mental health and wellness. And as Marion mentioned at the beginning, humor, I think, is one of our greatest strengths. And it's very important that we try to maintain that sense of humor because it can be both healing and uplifting. Lastly, look out for an IPAC messaging campaign that is in development and will feature Indigenous physicians from around the country sharing words of advice and encouragement during this challenging time. The last thing that I want to leave you with is the message that we are strong, we are resilient, we will get through this, however long it takes. There will come a time when we can all gather together again as families, communities, and nations. In the meantime, be gentle with yourselves and with each other, and let's hold the line to prevent further transmission of COVID-19 in our communities. Jay McWitch, and I raise my hands to all of you.
Thank you so much, Nell. We really appreciate those reminders, and you talked about the curve and what that means in our nations. And, you know, we're seeing the stats reported today from Indigenous Services Canada And you're absolutely right. We are behind the rest of Canada's curve. We're seeing our numbers in our nations increase, doubling in the last couple of weeks. As at the end of day yesterday, we had 164 positive situations in our nations. We've seen 17 deaths, 17 hospitalizations, 17 hospitalizations and 2 deaths. And our hearts go to those who are mourning those that have been lost. Let's get another perspective now on COVID-19. And I would like to call on Leah Bill. Leah, you are the president of the Canadian Indigenous Nurses Association. And we too, like Dr. Wyman said, hold you up. And welcome to the FNHMA Town Hall on COVID. Welcome, Leah.
Tanse, Nigan kita tamskat no gakyo. So firstly, greet everybody and want to express my gratitude and appreciation to FNHMA and also Nation Talk for providing this opportunity for us to, share our thoughts and perhaps convey a message of hope and also appreciation for all of those really hardworking individuals out there. We know that we have a vast number of Indigenous nurses across Canada who are working very, very hard, long hours, and appreciate the dedication. And we know that the demands on them are extremely high. And so, as you said, Marion, we hold them up, especially because they too have family members and children that they need to care for, as well as care for, in some instances, isolated communities and or communities with large populations. So I just want to start off by acknowledging that, and also my colleagues on the line, Bonnie and Nell. Really appreciate the opportunity to sit in the circle with you here today. In terms of SINA, one of the things that we've done, we've worked very closely with Dr. Tam and the CPA, the Public Health Officer, around making sure that we maintain consistent messaging. And I think that was really important because in having some discussions with colleagues across the country, as well as some health managers, one of the things that we're challenged with is that ability to actually convey a message in an Indigenous language so that people can comprehend it. Many questions are asked, well, why do we have to social distance, or why do we have to wash our hands so much? So I think one of the key things that I want to say is that it's really important to try to recruit individuals who are fluent speakers in their own language, and then translate that message into a message so that community members can understand it, because it's critical, I think, in terms of maintaining flattening the curve, or especially now that we are seeing that surgence in our communities. It'll be even more critical to relay that message. We've, of course, utilized our own social platform to relay messages and to upload information and respond to questions that are being presented by our colleagues, but as well community members. And I want to acknowledge our CEO, who has been working very hard to make sure that we maintain that connection with people across the country. And of course, we've been working very closely with Indigenous Services Canada. They rely on us as well to provide them with information, but also guidance, and really appreciate having had the opportunity to have discussions with Minister Bennett and that group earlier on in once the COVID was beginning to impact our nations. The other element, of course, is ensuring that we continue to support one another and to relay the same message. Like, I think sometimes we can get inundated by a lot of distractions, and particularly we see where historical traumas perhaps maybe may come into the field and really influence our ability to make good decisions. And so what we've been really trying to encourage is really try to focus on the tasks at hand and take what we've learned from the past and implement that in the present so that we can ensure that our people are protected and our people are receiving the best care, and remind those that are in power positions that we can utilize that knowledge from the past in a positive way and not allow it to interfere with the tasks at hand. We are very resilient people. We've overcome many challenges in the past, and I think that that's a positive thing. It's not something that should interfere with our capacity, but should actually strengthen us in a lot of ways. The other group that we've worked very closely with is the Canadian Nurses Association, CNA. So we had a similar Zoom call with nurses across Canada last week, which was very positive, along with their Indigenous board member. So we work fairly closely with them as well to make sure that we are continuing to support those nurses across Canada. I know many questions have been asked around PPE, and in our communities, of course, there's a big concern. They're not well supplied, but that continues to be something that I know the Chief Nursing Officer of ISC has. They've been working tirelessly on that to try to make sure that it's resolved, and we're encouraging them to certainly keep abreast of that. The one thing that we're looking at, which has been requested, is perhaps maybe some toolkits or resources for nurses and healthcare provider staff at the community level. And we've been working with ISC and CNA around perhaps developing something around a preparedness toolkit that'll assist them even further. And that's in the works right now. Nursing Canada is another area that we are nursing now. We've had to postpone that meeting, but we know that going forward, it'll be delayed till next year once all of this is cleared, and it'll give us a perfect opportunity, I believe, to really highlight some of those champions in communities and to really support nursing, and perhaps maybe an opportunity to relay the message to Canadians as a whole that Indigenous nurses are a very distinct group of healthcare providers who toil very hard to ensure that their communities are well and that their communities are well taken care of. So I guess Nursing Week is coming up this week, next week. And again, we won't be able to come together in the same way we normally do. I want to send a message out to all my colleagues across the country that you're in my prayers. And we hold you up in very high esteem. And I hope that you're surrounded by people that love you and that ensure that you too are getting that extra support that you need now, especially. So, I'm very honored to have had this opportunity to speak with everyone. Thank you.
Thank you so much, Leah. We really appreciate that you talked a lot about messaging and partnerships, and a note for all of the viewers and listeners who we have tuned in right now. All of the organizations represented here have, hashtag United First Nation Health messaging, and we did come out with a public service announcement thanking all of you in our nations, protecting our communities and providing that safety that we need right now. And so what a wonderful way to break down barriers and silos and institutional walls. Now's the time when we demonstrate partnerships in action. With that being said, let's go over to our other partner, and I'll just ask Leah to mute her mic now, and we'll come back to you for questions. Bonnie, we have Bonnie Healy with us, who is the chair of the First Nation Information Governance Center. Thank you so much, Bonnie, for being with us here on the FNHMA Town Hall regarding COVID, and welcome.
Okay, Marian. Okay, Nistu Anago Aboyaki, Idamik Skanatani. It's a beautiful day today. I'm sitting today in my home territory. I have recently moved to Kainai Nation, and I'm just honored to be asked to join this panel of wonderful women, both Leah and Nell, and the messages that they've shared. So I'm coming with a bit of the data message from the First Nations Information Governance Center. I've been chairing the organization for past couple of years, and I've been working with the FNIGC probably for about the past 15 years. We transitioned from a committee to an incorporated entity, and we've been incorporated since April 22 of 2010. So this would be our 10th anniversary that we're celebrating in this pandemic. And I'm one of the founding inaugural board members of the First Nations Information Governance Center. And in the past few years with our strategic planning is we're really trying to support First Nations in achieving data sovereignty within their own distinct nations. And so developing that data system that is cohesive and timely, readily available to First Nations is imperative, especially in a pandemic. And when we first started to look at what we were going to do to support what we had available, one of the early things that I did in the beginning of this early March is I started to pull the data. And I'm very fortunate here that for the past 10 years, I've also developed the Alberta chapter of the FNIGC, and I've recently moved over to the Blackfoot Confederacy as the health director for the 4 Blackfoot nations, and we have 1 nation in the U.S., which is about 45,000 people in population, and could be higher if we counted our residency. So the problem with data and inaccuracies in data and demographics and trying to figure out who your vulnerable population group is we don't have that data set. The Indian Registry is inaccurate, Stats Canada is inaccurate, and nobody has a residency code, so that we can't get to the actual numbers that are within the community to have a true understanding of who our vulnerable population group is and how do we plan for that. So what the First Nations Information Governance Center is trying to do is to work and support leadership and communities to really have a nation-based approach to developing a information system that makes sense to them. Developing evidence-based planning that is rooted in their worldviews, and they want to close gaps that are not just from the Western deficit model of identifying those gaps, like epidemiology. So we also want to close the gaps that matter to us, is how far away are we from being the life that creation intended us to live as Indigenous people, so before colonial impacts. And one of the things that we did is we pulled the regional health survey data, the First Nations early childhood data, and the oral health data that we had, but it was the RHS data that we pulled a report to support nations when they're applying for funding because we knew that the funding allocation dollars that went out to nations was going to be ineffective. They weren't based on true needs because the data is not available to nations to really identify what their true needs are. And I think Nell and Leah had stated very accurately that the primary care networks and how they're funded within First Nations is not effective. And nations are still trying to work on how they are going to provide the best possible care in the community. But so I'm very fortunate. Within Southern Alberta, we have strong relationships with Alberta Health Services, but not all nations across Canada have that same relationship. And we, with our 10 partners across the provinces and territories, not every province has identifiable First Nations, Inuit, and Métis data. Some better than others, and but there is not a really good surveillance database across Canada. The health data is set up into a national database from each province and territory, but it does not have First Nations, Inuit, and Métis identifiable data. In Alberta, we've been working since June 2013 to develop a health information agreement to be able to identify First Nations. And so you'll see on the AFNIGC website, we've pulled a lot of things. So Alberta is in a really good position to be able to understand how this the COVID epidemic is going to affect us. We understand what the comorbidity rates are because we've created those unique life identifiers within the health surveillance system. And the so we pulled the data from the influenza pneumonia outbreak last February, and that gives us a really good understanding of who our vulnerable population groups are and who we have to be able to protect. And it is our elders, and we do have age groups that are younger that are living with multiple comorbidities. So it's not just your 70 to 80-year-olds. You know, we're looking at 40 to 50-year-olds too that have vulnerability. And I just want to echo the importance of really understanding that we're going to move forward because we are resilient people. I'm Blackfoot, and the guidance that we're getting from our elders, I'm very involved with our home community ceremonies, and I just want to share something with you, just because we're in the middle of developing our Blackfoot well-being model, and in these uncertain and challenging times, you know, posed by the threat of coronavirus, the Blackfoot people will continue to draw from our traditional models of wellness and cultural values to promote strength and resiliency. So Dr. Leroy Littlebear has been working with us to really develop our model of wellness. He reminds us that Blackfoot values are interrelatedness and mutuality and reciprocity. We guide our actions and our prayers for others. The Blackfoot model of wellness promotes a holistic approach to well-being whereby physical, spiritual, mental, and emotional health are interrelated and equally important. Hence, the pandemic response planning in Blackfoot context must take into account how these various aspects of health and well-being might be impacted by threat of infection, and more importantly, how measures will be taken to address these factors in a holistic and culturally appropriate manner. So Blackfoot philosophy, for example, acknowledges that people, the environment, and events are inextricably interconnected, and that the forces that shape our well-being are always in flux. This deeply held cultural belief in the interconnectedness of lives and the ever-present fluidity of circumstances is a strength that Blackfoot people are able to draw on to cope with challenging events. A shared understanding of interconnectedness means that our communities are guided by principles of collective well-being and mutual support to ensure health of our community members, as well as those across the country and internationally. So moreover, the Blackfoot recognition of the shifting nature of lives and events, the constant flux, prepares our communities well to anticipate the need for a flexible response to a rapidly changing pandemic threat. Lastly, Blackfoot communities and people have historically experienced socioeconomic disadvantages, social injustices, and health inequities that have greatly impacted our well-being. Yet our communities have continued to flourish and retain our unique cultural identity. In the face of these challenges, we have been able to do this by drawing on intrinsic strengths and resilience embedded in our cultural values and modeled by our elders. This strength is characterized by both the inner resilience that individuals are encouraged to cultivate to cope with personal challenges, as well as collective practices of generosity, support, and empathy for those most vulnerable in our communities. This collective strength and cultural resiliency will continue to guide our efforts to respond effectively to the coronavirus pandemic. So with that, I want to thank you, Marian, and the other panel members. I think I too echo, that all of us across the country and the world stay safe. I have close connections in Australia and New Zealand. Also have close connections in the Navajo Nation. So my heart goes out to them. I continue to pray for them daily. And I think if we only look at this from Western indicators of measuring how we're going to make out, I think, we'll lose the best part of us, and that's our strength and our resiliency. Our ancestors, are there cheering for us. They're helping us through. And thank you.
Before you leave us, Bonnie, so I'm going to go into the Q&A portion. And for all of our listeners and viewers right now, stay tuned right to the very end. FNHMA has a very special announcement that we want to share with you, and we'll get to that in a little bit. But Bonnie, you talked about the social determinants, our resiliency, about data and the power of that in terms of having data for us, by us, and the Regional Health Survey. What do you say to all of our non-Indigenous listeners and watchers who are in positions of influence? What's the messaging there that you would give perspective on, Bonnie?
Hi, Marian. Thank you for that question. And I think that it's important that when you're looking at data sets, that to understand that you're looking at them from primarily a Western worldview. So they don't reflect a First Nations worldview in its entirety. Even the Regional Health Survey has some questions that are from the community or the Canadian, just so that we can have comparability. But when we're measuring things only from a Western worldview, we're looking at the deficits. So we're just counting incidences of disease. But if we measure well-being and how we're responding and how we're surviving as a people, and why we're resilient in the way that we are, is because we think collectively. We don't think as individualistic terms. But it's also important, I think, for Canadians to understand that First Nations health systems are different from the ones that are within the province. And so the ones that are in the communities on the reserve, there's a jurisdictional patchwork of how primary care networks, or we're not funded for primary care networks in the communities. We're only funded for the public health portion of things. And with that, I think we have to support, I think, the non-Indigenous people to understand that we don't have the evidence that other Canadians have access to make proper evidence-based decision-making, that we're still trying to get that data system in place. So we're expected to govern without having really accurate evidence. And the data has been controlled by our funders. So been controlled by the province, been controlled by the federal government. We actually have not had any control of the information or how we're spoken about. So we're trying to change that relationship so that we can, look at the data, find its inaccuracies, and then make some better informed decisions on the true information that and the true scenarios that are going on within communities. And I can only give a small example. So when I was working with the province to develop the unique life and indicators, we pulled the Indian registry for all of Canada through a data sharing agreement or an access to information request from Indigenous Services Canada. We got that a number of years ago, and we have a lot of support from Minister Carolyn Bennett to do this work. And what we found, because the Indian Registry does not have a direct relationship to vital statistics, is the timely updates for deaths and births is not within the Indian Registry. So the numbers are extremely inaccurate. When we pulled the Alberta data, 10% of the population was 106 years old. And they didn't have the births registered right away. And for Leah and Nell, being nurses and physicians, we've seen that for a number of years as babies don't get registered right away. And that delay in registration causes a lot of problems with funding. And so when we pulled the true numbers, and I was interviewed with former Chief Lee Crowchild in a June edition of Windspeaker on the inaccuracies of data systems. And when we pulled and looked at StatsCan data, Indian Registry data, and the Alberta Health data. So in June of last year, StatsCan had First Nations in Alberta at 111,000, and Indian Registry had us at 89,000, whereas the true number was 165,156 individuals. So when you have that kind of discrepancy in data systems and you're trying to do evidence-based planning in a pandemic, what number are you going to go with? The 89,000 and miss half the population, or the 111,000 and miss like a good quarter of the population? But you want your truest number. And even the 165,000 is not a true number because we don't have the residency code. So we need to really develop that strong census within community that's gathered by us and for us, so that we can make some better informed decisions. And the migration movement from community to the reserve is so fast that it's not, as Leroy Little Bear states, we're in constant flux. So we've seen a lot of the movement from nation members that live in the cities, and then when they get sick, they want to come home and isolate at home. So this communication between health systems needs to be very strong because the individuals are going to move very quickly. And with privacy regulations and individual privacy, we're not always going to be informed, but we're trying to figure it out together in partnership, at least with our provincial systems and our nations, to be informed, protecting the individual, but also protecting the collective.
Thank you. So much to unpack in what you just said, and we could have day-long sessions about all of those messages. When we think about protecting those individuals too, Nell, I think there's a question here that I'm going to send over to you. One of our inbox questions talks about COVID-19 being especially hard on those with high blood pressure, diabetes, and obesity. Is there any thoughts that you can share about triaged response if an outbreak occurs in a nation? So, Dr. Wyman.
Thanks, Marion. There's a couple of things to keep in mind. So as I mentioned in my remarks around what we know about COVID-19 so far and how people are affected by it, there is some evidence to suggest that people who are in the older age groups and may have pre-existing conditions, medical conditions, such as you mentioned, like diabetes, high blood pressure, may be both at risk of a more severe course of illness and even death. But that's not to say, I think it was Leah mentioned and Bonnie, that the younger age groups may also have coexisting medical conditions and also be at risk as well. So in terms of triaging in communities, it's important. The way on an individual level that I've been talking about COVID is to behave, all of us need to behave as if we actually have it, and we're trying not to transmit it to other people. So we're doing everything we can to keep ourselves kind of intact and away from the people, from everyone else, but including the people who would be considered most vulnerable. And related to that is, it is important for the people, if you are a bit older or if you have one or more pre-existing conditions, that you both continue with your primary health care wherever that may be that you're receiving it, whether, if you're in a rural community or a remote community, from the nursing station, or now many medical appointments are taking place, or healthcare appointments are taking place by virtual means. So telemedicine or the telephone, video conferencing. So continue with the regular monitoring and maintenance of your condition, so that making sure you have enough medication if you're on prescription medication, and keeping in good touch with those primary health care providers. There's variability across the country. So for example, in British Columbia, we worked in partnership with the Rural Coordinating Center of British Columbia to establish the Virtual Doctor of the Day program. So people who may not be able to access their regular physicians or have no family physician or nurse practitioner or very limited access can actually reach a family physician virtually and receive a prescription or advice around their health condition. So bottom line, very important to keep up the regular health services that you receive. And then the other thing I would encourage people to do is, do not hesitate if you have an urgent or emergent medical emergency to seek help. We've heard some stories of people being reluctant to come forward and seek help because they don't want to go to an emergency department, thinking that, their risk of getting COVID is increased. It's important for people to know that, the people who work in our emergency departments and hospitals are wearing a lot of personal protective equipment. And as I mentioned, the role of that equipment is to ensure that, they are kept safe, but also they are keeping you safe by wearing that equipment. So if you're having chest pain, or you're noticing severe shortness of breath, or your blood sugars have been way out of control compared to their usual, I do encourage you, and all of us encourage you, to seek the help that you need.
Thanks, Nell. We really appreciate that. Speaking about the health and safety, I'm going to go over to Leah for this next question. Leah, with that nursing lens, what are some of your thoughts on some of the obligations for health and safety of staff? We know that provinces are talking about reopening office space in some areas. What are your thoughts on keeping health and wellness top priority for our staff when we do start to congregate back at the offices? So over to Leah.
Now, thank you for that opportunity to answer that question. And I think that we need to really hold our funders, which is primarily Indigenous Services Canada, right, who funds our health delivery systems. We need to hold them accountable to be able to provide us with the appropriate amounts of protective equipment. We know when they are trying, but the PPE equipment is in demand right across the systems, including retailers. They're not receiving the amount of equipment, but I think first and foremost is those people that are actually trying to protect the health and well-being of people. That should be a priority for us, and I think we're hearing the same message from MOHs, or medical health officers, that first and foremost, we need to always be cognizant of the essential workers first, that they require that protective equipment. I know that our communities have been struggling, and we're now in some areas where they're not just dealing with COVID, but where they're dealing with natural disasters as well, such as in Fort McMurray, where they recently had their flood. So it makes it even more challenging to provide the protection that's needed. And I think that as leaders, as spokespersons for our people, we need to be very, very diligent and continue to really push to ensure that those services are and equipment are provided for us. At the same time, we're not the only ones. I think we need to also acknowledge, our Métis citizens who are also experiencing a lot of challenges. They're just as lacking in resources as we are. As a matter of fact, more so in some of those isolated or northern Métis communities. So they're really challenged for even acquiring resources or equipment to protect their workers and to protect their citizens.
Thank you so much, Leah, for giving your perspective on that. Our viewers and our listeners really appreciate that message. And I just want to say again, what an amazing group of ladies. This is the front lines. They represent our frontline nurses, our physicians, and no one can make informed choices without strong data. And so just hats off to all of you for being able to participate in this town hall. Speaking of, participating, I do want to just give a moment here where we can share with you some information from the First Nations Health Managers Association about where to find some important information. We're hearing from numerous people that it's hard to navigate all of the barrage of information that's coming to the inboxes of our health directors, all of that circle of care in the providers. And so the FNHMA is really excited to announce our newest initiative, and that is with respect to COVID-19 creating challenges for First Nation health managers and communities across the country. These challenges have given rise to questions without a real clear place to ask them. And part of that response is in hosting these weekly town halls with everybody. To further address this, I'm really pleased to share InfoPoint. InfoPoint is going to be a convenient, accessible, helpful desk for First Nation health managers. So starting on Monday, May the 11th at 8 a.m. Eastern Daylight Time, you can contact InfoPoint by phone or by email. It's really designed for all of you hardworking, dedicated, and busy health managers who need credible sources of information now. And we want to be able to support you in your roles in keeping the nations healthy and safe with credible information. We want to be your reliable source for health and COVID-19 related questions. So as of Monday, give us a call if you need some support navigating information. We're going to be ready to answer those calls, to respond to your emails. And if you want to give us a call, you can do so. And we'll have this up on the site underneath the video, but you can call us at 1-855-446-2719, and you can actually talk to a real person. And I can't tell you enough how much I appreciate the dedication of the FNHMA family and staff for making this possible. If you can't pick up the phone, or if you just want to send a quick email, you can email us at FNHMA at infopoint@fnhma.ca. We definitely look forward to hearing from you, and reach out. We're providing this service to health managers and directors across our nations. And again, that's infopoint@fnhma.ca. The phone number will be shared with you, and a large public service announcement campaign will be started on Monday so that you know where to get this information. Speaking of sharing information, Indigenous Health Today.ca is also partnered with the First Nations Health Managers Association in providing updates, tools, any kind of communiques that are coming out from Indigenous Services Canada, and they are breaking down that information by region. If you have information you want to share, let FNHMA know. We'll make sure it gets put on indigenoushealthtoday.ca. We'll be directing our traffic to that website as well. So please feel free to support your health managers and health directors in these services. So there's no going back now, FNHMA staff, all those helpful desk folks. Monday, we are online. So with that, I do want to wrap up and give some shout outs. Obviously, we can't make this happen by ourselves. First of all, thank you to the incredible, powerful ladies who have joined us as subject matter experts today. Thank you so much. Canadian Indigenous Nurses Association, Indigenous Physicians Association of Canada, and of course, the people we cohab with in Akwesasne, the First Nations Information Governance Center, appreciate being able to share our lives together in that regard. I do want to say a big shout out to TELUS, who provide the phone lines. APTN has stepped up and been with us, providing messages on their Facebook, so APTN News. Obviously, Nation Talk, as I said, here in their studio, Indigenous Health Today. You know what? The Wolf in Fredericton, you can definitely see us on their Facebook, Eagle Feather News Facebook. NCI FM radio is also on Facebook with this message. CFWE FM in Alberta, CKLB FM in Yellowknife, CJWE FM in Alberta, and Element FM in Toronto and Ottawa. Alberta Native News, we're on your Facebook as well as Micmac Maliseet Native News, Co-op Radio, and the First Nations Drum in Vancouver. You can hear these messages and continue hearing these messages live, and also rebroadcast on radio. MBC Radio is Thursday at 3 p.m. in Saskatchewan. Hey, Saskatchewan. CKLB Thursdays at 4 in Yellowknife. Co-op Radio Thursdays at 5 Pacific Daylight Time, and the Wolf 95.7 in Fredericton. So with that, don't forget to call InfoPoint, brought to you by the First Nations Health Managers Association. For everybody who I hope listened in your language of choice, thank you to Ms. Belanger for doing our French translation of this episode, and of course to the technical team, to Chris, Stella, Dawn, we appreciate you. TELUS again, thanks. APTN, thanks. But to the FNHMA family, a huge vote of love and support. We can't thank you enough for working so tirelessly to support our health directors and our health managers. With that, I wish you all to be safe, be healthy, be well, social distance, and hi.